Building an equitable healthcare system through blood donations. Today, we're going to look at building a healthy and stable blood supply that allows all patients access to equitable care. We'll learn about the changing demographics of blood donors and how that impacts the future of healthcare. And then we'll also learn a little bit about the history of blood donations and why it's so important to advocate for both a diverse and strong blood supply. My name is Teresa Pina. I'm the Vice President of Operations at Gulf Coast Regional Blood Center in Houston. Our blood center is a member of America's Blood Centers, and I've been in blood banking over 17 years, and I focus on marketing, donor recruitment, our mobile operations, as well as collections training. So let's start with a little bit of history about blood donations. In the beginning, civilian blood donations became popular during World War II. It really became a necessity. And 13 million pints were collected for war efforts. Now, this was not only a need, but it was also more of like an obligation about what I could do for my country to help during a time of war. Baby boomers at this point, this is where they really became to know blood donations, and it became kind of who they were and how they supported their country, very much like voting. Now, baby boomers have reached a point in their lives where they have become more users of blood donations rather than blood donors. Now, across our nation, there's nearly 42,000 blood components that are used each and every day. We'll get a little bit into blood donors about who is eligible. In the United States population, 62% of our population is eligible to donate. So that's about 204.9 million individuals. But there were only about 7.3 million donors in 2019. So that'll show you how many people are donating. So on average, 3% of the population donates blood each year. Now, America's Blood Centers operates more than 600 blood donation collection sites across the nation, and together we provide 60% of the U.S. blood supply. First-time donors are so important to the blood program. First-time donors are responsible for 31% of the U.S. whole blood donations, while the remaining of those are repeat donors. Men donate a little more than women do, but not by much. But when we get into blood donors by age range, you can see that the primary donors are your 25 to 64-year-olds that account for 63.2%. We have our young donors that are 16 to 18 at 11%, 19 to 24 at 8.6%, and over the age of 65 at 16%. There's been quite a bit of change over a 10-year period. You'll see that there's been an increase, a pretty significant increase in the donors that are 60 and up by about 52%, but there's been a decline in the number of younger donors, about 31% in that change over time. Minority donors are very important to the nation's blood supply. About 19.5% of blood donations come from racial or ethnic minority donors. That includes African American, Pacific Islander, American Indian, and Hispanic blood donors. Now, why is that important? Well, every 2 seconds someone uses blood. We're going to get into why minority donors are important, but this is general blood transfusion needs. So in patients over the age of 64, transfusions and blood products rank as the second most common procedure in the United States. And between the age of 45 and 64, it's the 5th most common procedure. And overall, transfusions of blood and blood products occur in 3.5 to 5.1% of hospital stays, depending on which age group we're talking about. Now, 25% of the blood supply is used by patients battling cancer. That's pretty substantial. More than 1.9 million people are diagnosed with a new cancer every year, and many of them are going to need a blood transfusion during their chemotherapy treatment. Now, they may need it due to anemia, low blood counts. A lot of that really has to do with the chemotherapy and or radiation, and then some of that is due to blood loss during surgery. Now, this is where minority donors really come in for blood transfusions. So sickle cell disease, you may be familiar. This is when the red cells are hard and crescent shaped. Now, sickle cell disease occurs in about 1 in every 365 African American births. and they occur in about 1 out of 16,300 Hispanic American births. And then 1 in 13 African American babies are born with sickle cell trait. Now, why is that important for sickle cell patients? Well, sickle cell patients require regular blood transfusions throughout their lives. This helps prevent sickle cell complications such as organ and tissue damage, severe pain, and strokes. But oftentimes, sickle cell disease patients don't receive the level of care they need due to the limited blood products available. Now, donated blood must be very closely matched to avoid transfusion-related complications. But in sickle cell disease patients, it's more compatible if they receive blood from a donor that's of the same race or ethnicity, and African descent are the best matched, typically for sickle cell patients. Now, blood transfusions are a lifeline for sickle cell patients, and 1 in 3 African American blood donors are a match for a sickle cell patient. The other big user of blood are for trauma patients. In the US, hemorrhage is the most common cause of death within the first hour of arrival to any trauma center. More than 80% of deaths in the operating room and 50% of deaths in the first 24 hours after an injury are due to severe blood loss. Now, 3% of the civilian trauma patients will receive massive transfusions. That's more than 10 units of red blood cells in 24 hours. And then these patients consume about 70% of all transfused blood at a trauma center. Now, gunshot wounds and gunshot victims are approximately 5 times more likely to receive a blood transfusion. They require 10 times more blood units and are 14 times more likely to die than people seriously injured by a motor vehicle accident, non-gun assaults, falls, and stabs. The other big user of blood are hemorrhaging mothers during labor and delivery, and 1 in 83 infant deliveries will require a transfusion. Now that's for infants and pediatric cases. Pediatric patients use about 652,000 units of blood annually across the United States. When we get into topics of interest, acts of violence, unfortunately we hear so many of these across our nation daily. That is in school shootings or mass terrorist events, that type of thing. Those all end up using quite a bit of blood. And oftentimes people will run out to their local blood center when they hear of one of these things. Now the problem is the blood on the shelf that saves lives. So we all appreciate people coming down and donating after the fact, but really it takes 24 hours to process the blood. So from the time you make your donation, we have to componentize the blood and break it down. We do disease testing, quality checks, label it, and we've got to get it into the hospital. So from arm to shelf is about 24 hours. So it is that blood on the shelf that will save lives. When we get into LGBTQ plus eligibility, we hear a lot about this in the news here recently. And there's a long history about why there is this deferral, and this is called the MSM eligibility deferral. In 1983, during the height of the AIDS epidemic, the federal government instituted a lifetime ban on blood donations from gay men. It took a really long time, but in 2015, the rule was replaced with 1 year of abstinence, and that made you eligible. And then in 2020, the FDA relaxed that guideline to 90 days with abstinence. And then in December of 2020, some centers got together with the FDA to do a study. It's called the Advanced Study, that's really focusing on evaluating alternatives to the current MSM policy by the FDA. So we're really looking forward to the outcomes of those. Those sometimes can take a little time, but we're all happy that they're in process. Now, how can you help? Local involvement is key. So educating and encouraging your classmates, friends, and family. Hosting regular blood drives with your community blood bank, and then even partnering with your community blood bank to see what resources and offerings they have available for education and partnerships. If you need help finding a blood center in your community, you can go to americasblood.org and look up for donors and find a blood center, and you'll be able to find one in your community. Some simple blood donation facts. General eligibility, you have to be about 17 years of age, 16 in some states with parental consent. You need to be in good health and meet all the minimum weight requirements. And then you can donate about every 8 weeks. I'm going to leave you with a reference link in case you want to reference any of the statistics that I called out today in this presentation. But we look forward to seeing you donating blood at your local community blood bank. And thank you so much for having me.